10 political commentator Sue O'Connell joining us right now. Sue, let's talk money. Both Trump and Harris, they say that their economic platforms will reduce costs for the middle class. I want to compare what each of them have to say about our two biggest expenses that we all have, right? Talking housing and health care. We're going to start with housing. Harris wants to ensure that at least 3 million new affordable homes are built, and she wants to expand the low-income housing credit and offer first-time home buyers a tax credits up to $15,000. Trump wants to open up federal land that is for private companies to build homes on. He wants to cut regulations for those companies, and he says that that will drive up the costs of building. He's also suggesting some tax incentives, but he hasn't offered a number on those incentives. With that aerial view, right, both plans are a bit vague, but there are some clear differences between them. Fill in the gaps for us here.
Yeah, first, Colton, as you note, it's important to realize that every single candidate for president likes to keep things vague. Republicans, they traditionally run on values, right, and Democrats on hopes. But we do have a little bit of meat on the bone here to pick at. And I'm going to say that the Harris campaign has offered more specific details than the Trump campaign. The big difference here in the housing plan is who is responsible for reducing housing costs and providing more housing, the federal government or the state and local governments. Now, Trump says state and local, and that's why he's saying regulation should be eliminated. That he says would lower the cost of building homes for developers, and then they would pass those savings, he says, along to renters and buyers. Harris says it's the federal government's job, and that's why it's tax credits, lower mortgage rates, and rent increase caps. That would make housing affordable, she says, for individual buyers and renters. Now, look, Trump also throws in the mix here that immigration, legal and otherwise, drives up the housing costs. So his stricter immigration policies would open up, he says, more housing stock. But economists say that fewer immigrants and migrants mean fewer people to build the houses, so that would mean higher prices. And Harris's plan certainly makes sense on paper. But look, housing prices have stayed high for at least the past decade, so they don't show any signs of dropping. We'll have to wait and see what else they have to tell us.
Yeah, that's interesting perspective there. Let's talk health care quickly here. Harris wants to expand the Affordable Care Act, Obamacare. She wants to automatically enroll the 4 million Americans who qualify for Medicaid, but who currently aren't able to take advantage of it because they live in a red state. She also says that she wants to empower Medicare to negotiate with pharmaceutical companies for lower drug costs. Trump says that he, too, will promote choice and competition. He promises to protect Medicare and expand the affordable health care as well. But again, it's all a bit vague. Republicans still say that they're opposed to Obamacare, the Affordable Care Act, and they say that they want it repealed. We know that Harris's plan would lean on that and potentially expand on it. Would Trump's?
Yeah, well, you know, Trump and the Republicans, they're not only being vague about the health care plans, they're also being confusing, and I think on purpose, right? Although Trump and the Republicans, as you've noted, have worked to revoke Obamacare since it was passed in 2010, and as soon as Trump got into office, also known as the Affordable Care Act, or ACAM, is if you're following along at home, ACA, I'm sorry. But the repeal of Obamacare, it wasn't even in the Republican Party platform at the RNC, right? And it's probably because of how popular and successful it is. But Harris and VP candidate Tim Walz, they say Trump, if elected, is going to end the ACA, and that will give insurance companies the power to deny insurance to those of us, basically all of us, with pre-existing conditions. That's one of the most popular parts of Obamacare. So remember, while President Trump never had a plan on what would replace Obamacare if he repealed it, and he absolutely does not have a plan now. But there are some hints in what Trump's plan actually would be if he was elected, Project 2025, and that's that report that some call the blueprint for a Trump second term. And other Republicans have said they indicate that they would tighten access to coverage in Obamacare and curb abuses. And that, of course, would make it harder to use. But right now, it's all very vague, Colton.
All right, our Sue O'Connell there live for us in the newsroom. Sue, as always, thank you. And don't forget, we recap all the latest political headlines every Sunday morning for you right here on NBC Boston. Meet the Press gets the ball rolling at 10:30. And then immediately after, you can join Sue, Corey, and Matt Pritchard for the latest episode of At Issue.